Welcome to Rapid Relief Health. Imagine reclaiming the ability to move with confidence and freedom, to walk up a flight of stairs or enjoy a gentle hike without that familiar nagging ache in your knees. For many over the age of 60, this can feel like a distant memory, replaced by a cautious, often painful relationship with movement. Knee pain, whether stemming from arthritis, general instability, or the natural weakening of supporting muscles, is incredibly common, but it is not an inevitable sentence. The difference between persistent discomfort and renewed mobility often lies not in a miracle cure or complex surgery, but in a fundamental understanding of how the knee functions and the targeted, consistent strengthening of its crucial support system. Research from leading orthopedic institutions consistently shows that strengthening the muscles surrounding the knee can reduce pain by up to 40% and significantly improve functional mobility, often preventing the need for more invasive interventions. Your knee joint is not designed to operate in isolation. It relies on a muscular framework, the quadriceps in front, the hamstrings behind, and the glutes and hips at the core for stability, shock absorption, and proper alignment. When these muscles weaken due to age or inactivity, the knee bears undue stress, leading to pain, accelerated wear, and a loss of confidence. Today, we will move beyond general advice and focus on a precise 3-exercise routine designed to rebuild this foundational support. This simple daily practice has empowered individuals to transform their mobility, and it can do the same for you. Exercise 3, the seated knee extension, foundational quadriceps strength. We begin with the seated knee extension, an exercise that isolates and strengthens the quadriceps, the large muscle group on the front of your thigh that acts as the primary stabilizer for your knee joint. Every time you stand from a chair, climb a step, or simply walk, your quadriceps control the extension and alignment of your knee. When these muscles are weak, the joint becomes unstable, forcing cartilage and connective tissues to handle forces they weren't designed to withstand. This exercise is powerful in its simplicity and safety. By performing it seated, we remove weight-bearing stress from the joint itself, allowing you to fortify the supporting musculature without aggravating the knee. A 2024 study in the Journal of Orthopedic Research involving hundreds of seniors with osteoarthritis found that consistent quadriceps strengthening led to a 35% reduction in pain and a 42% improvement in physical function. Even a modest increase in quadriceps strength can dramatically decrease the load on the knee during daily activities. Execution. Sit tall in a sturdy chair with your back fully supported and feet flat. Slowly straighten one leg until it is parallel to the floor, ensuring your knee is extended but not locked. Hold this top position for 3 seconds, consciously contracting the thigh muscle. Then lower your foot back to the floor with a slow, controlled 3-second descent. This eccentric phase is where significant strength gains occur. Aim for 10 to 12 repetitions per leg, completing 2 to 3 sets. Focus on smooth, deliberate movements, avoiding any jerking or swinging. This exercise builds the essential anterior support your knees crave.
Exercise 2, the standing hamstring curl, balancing posterior strength. While the quadriceps often receive the most attention, the hamstrings, the muscles on the back of your thigh, are equally vital for knee health. They act in harmony with the quadriceps, controlling knee flexion and providing crucial dynamic stability. A significant muscle imbalance, where the quadriceps overpower weak hamstrings, is a common culprit behind improper kneecap tracking, joint stress, and pain. The standing hamstring curl not only strengthens this often neglected muscle group, but also challenges your balance and single leg stability, engaging your core and hip stabilizers in the process. Research from the University of Delaware highlights that individuals who improved their hamstring to quadriceps strength ratio experienced nearly 50% less pain during daily tasks. This exercise is about creating balanced, harmonious strength around the joint. Execution. Stand behind a sturdy chair, using it lightly for balance. Shift your weight onto one leg. Keeping your thighs aligned, bend the opposite knee to curl your heel toward your glutes. Hold the contracted position for 2 seconds, feeling the engagement in the back of your thigh, then lower with control. Crucially, keep your torso upright and avoid arching your back. Perform 12 repetitions per leg for 2 to 3 sets. As your balance improves, challenge yourself by using less hand support. This movement builds the critical posterior chain strength that acts as a stabilizer for every step you take. Exercise 1. The wall sit. Integrated endurance and stability. Our top exercise, the wall sit, is where true functional stability is forged. Unlike the isolation of the first two movements, the wall sit is an isometric hold that simultaneously engages the quadriceps, hamstrings, glutes, and core in a sustained contraction. This mimics the muscular endurance required for real-world activities like prolonged standing, walking, or climbing. This exercise addresses a critical gap. Many can develop strength but lack the endurance for sustained activity. Furthermore, by strengthening the glutes and hip stabilizers, the wall sit directly combats a dangerous movement pattern where the knees collapse inward, a major source of joint stress. A landmark 2024 Johns Hopkins University study found that seniors who incorporated isometric exercises like wall sits saw 56% greater improvements in pain during prolonged activities compared to those doing only dynamic movements. Execution. Stand with your back against a smooth wall, feet shoulder-width apart and about 2 feet from the wall. Slowly slide down into a seated position, lowering until your thighs are as close to parallel to the floor as is comfortable. Ensure your knees are directly above your ankles, not jutting past your toes, and press your entire back into the wall. Hold this position, breathing steadily. Start with a manageable hold of 20 to 30 seconds, rest for 60 seconds, and repeat for 2 to 3 sets. The goal is to build time gradually while maintaining perfect form, with a focus on keeping your knees aligned over your feet. The integrated routine for lasting knee health. The true power of this approach lies in the synergistic combination of these 3 exercises. Together, they form a complete 10 to 12-minute routine that rebuilds your knee's support system from every angle. 1. Seated knee extensions. Activate and strengthen the primary stabilizers, the quadriceps. 2. Standing hamstring curls create crucial muscular balance and dynamic stability. 3. Wall sits build the integrated endurance and hip-driven alignment needed for prolonged activity. For optimal results, perform this sequence 4 to 5 times per week. Consistency is far more important than intensity. Allow your muscles at least 2 full rest days for recovery and adaptation. With dedicated practice, most individuals begin to notice meaningful improvements in stability and a decrease in pain within 3 to 4 weeks, with substantial gains by the 8-week mark. This is more than an exercise routine. It is a reinvestment in your foundational strength. You are not merely managing symptoms, you are actively rebuilding the muscular architecture that determines how you move through life. The path to pain-free knees and confident mobility begins with a single, deliberate step. Start tonight. Your future, more active self will thank you for the commitment. Thank you for prioritizing your strength and mobility with Rapid Relief Health.